Guyana, as I said, has prime conditions. If something like that gets here, it will spread. So we don't want to have the introduction of yellow fever into any of our urban areas, definitely at this point in time. But we have not won the fight against the Aedes mosquito. There are very many of them around, and they can carry this germ, like they're doing with chikungunya, Zika, and dengue.
At present, though, we don't have a yellow fever issue.
We don't have disease. Right? As I said, some spots in South America, there are some disease detected among the salvatic environment, meaning the primates. Right? No human cases.
That was Chief Medical Officer Dr. Shamdeo Persaud. Dr. Persaud has confirmed that Guyana has begun to intensify its efforts to deliver yellow fever immunization vaccines. This move became necessary in wake of other countries clamping down on the requirement for immunization certification from travelers.
Since the requirement became known, especially from Suriname, we have intensified delivering vaccines here at the Vaccine Center of the Ministry, and we have also established regional centers. We even have a private sector site, I think it's operational now at Mercy Hospital, where persons can acquire the vaccine, right, and obtain the certificate.
Dr. Persaud notes that once immunized, one simply has to produce the immunization card to the Public Health Ministry to be issued with a certificate. The Chief Medical Officer says the immunization move by local health authorities is not to create unnecessary scare, but to sensitize locals of the need for prevention of an illness that can prove fatal.
If you did not have a vaccine in the past, then, or you cannot find that record, then we have to re-immunize you 10 days before you travel and then issue you that certificate.
If you're not immunized and you get yellow fever, what can happen to you?
With yellow fever is, as I said, a very disabling disease. As about a third of persons infected with that germ dies. First of all, it's a febrile illness, pains, fever, joint pains, and more particularly intense yellowness. So it affects the liver, so it's like jaundice, okay? And it causes damage to many of your organ systems in your body, so it's very disabling.
His comparison is that while Ebola results in 40% fatalities, yellow fever ranges between 35 and 40%, which is just as bad. Dr. Persaud has assured that most Guyanese have been immunized against yellow fever, and notable too is the fact that the World Health Organization, WHO, has announced that once one has had at least one shot against yellow fever, then you are protected. Without immunization, the risk is high that travelers can be refused entry to some countries, and as such, some airlines have begun taking precaution to restrict those who are not immunized. George?